So the level 3 facial electrotherapy award is especially sort of, design course for a beginner to skin therapy and aesthetics. It's one where we're bringing a beginner in that knows nothing about the industry, or someone that's actually been doing the treatments and have got the CPD level 5 diploma in aesthetics and need to have an off-call regulated qualification. The facial electrotherapy includes 5 different facials: high frequency, galvanic, microcurrent, EMS and vacuum suction. And after you've done this, you can then move on to the level 4. Really important to understand the layers of the skin and in relation to the treatments, the electrotherapy treatments that we're actually going to be performing. In the 5 layers, the first 2 top layers, the stratum corneum and the stratum lucidum, are the layers that we're going to treat, just get rid of the dead skin cells. And we're using like skin scrubber, we're using the dermabrasion, just to get rid of those dead skin layers. And those skin layers are actually constantly shedding, and the more that they are removed, and it's only these 2 layers that we want to remove, the brighter the skin is, and the cells underneath actually push their way up, making the skin look really glossy. We've got the stratum granulosum and the stratum symposum. Those 2 layers actually has got the Langerhans cells, which actually protect the epidermal layer of the skin, and you've got the keratinocyte cells. Now, these cells shouldn't be removed, so treatments, aggressive sort of peeling treatments actually would remove these as well, but it's not useful to actually remove these cells. In the electrotherapy treatments, what we're actually doing is we're actually pushing our products, our serums, our gels into these layers of the epidermis to actually really rejuvenate those layers. Stratum basal is actually where we're actually pushing in the gels for pigmentation. So actually the treatments that this would really help with is using the cavitation and the no needle mesotherapy to actually push in serums and gels and ingredients that actually balance the disturbed melanocyte cells. In this course, we're mainly going to be working on these 5 layers of the epidermis. We're not going to be working on the dermal layer at all. The stratum corneum has got many dead skin cells that constantly renew and shed itself. This is a protective layer which a lot of therapists forget. It's one that protects the skin against the environmental damage. The next one, the clear layer, is also providing protection. Prickle cell layer provides the skin strength and flexibility and actually forms the keratinized cells. Basal layer is the most important layer when it comes to pigmentation. This is where your melanocyte cells produce the skin color, and this is the ones that actually, if you're in the sun, the melanocyte cells are damaged, and this is where the pigmentation actually starts from. It's important to understand the structure of the skin, because this diagram actually comes up in your theory exam, so you need to really learn every single sort of structure of the skin. We start off in the level 3 electrotherapy course. We actually treat the epidermal layer. In the level 4, we actually treat the dermis. Level 5 and 6, we actually go into the subcutaneous layer with our fillers, our fat dissolving injections, our skin boosters. So each of the layers you'll be working on in level 3, level 4 and level 5. Really important to learn the structure of the skin as it comes up in your theory exams. You've got the sebaceous glands or stratum corneum, stratum, all of the layers of the epidermis are the ones that we're going to be working on. The functions of the epidermis, which actually will also come up in your exams, you really need to learn. The protective barrier. It's really important to remember that the protective barrier, the epidermal layer, shields the skin against bacteria and the environmental aggressors, constantly renewing and shedding itself. It takes about 28 days for the skin to shed and renew itself, and that's why we recommend the facials every 28 days. There's a lot that happens in the dermis, and the functions of the dermis there is a lot of as well. The collagen and elastin is actually in the epidermal layer, which it gives the skin strength, it gives it flexibility, resilience, and as we get older we actually lose the collagen and elastin fibers in our skin, and this is what causes the skin to age. And during these sort of earlier years, if we were to sort of maintain this layer, the skin would look very youthful. Hair growth is also in the dermis. You've got the dermal papilla in there, which is the growing part of the hair follicle in the dermis. You've got sensory function in there. You've got nerve endings in there which detect against touch, temperature, pain and texture. So whenever you're doing treatments, it's these nerve endings that are actually going to tell you whether the client is finding the treatment painful, whether your electroprobe is hot or cold. It's one that guides you to actually do your treatments according to the client comfort levels. The oil glands produce the oils, and the sweat glands actually regulate the temperature. So when you're actually sweating, the skin is actually releasing the toxins, and the blood supply, the blood vessels are actually supporting the whole health of the skin. The hypodermis is the bottom layer of the structure of the skin, and the subcutaneous layer is actually where the fatty layer is. This is the one that actually has the connective tissue and the bones which protect you against the injuries, supports the nerve endings, the blood vessels, and regulates. It actually insulates you against the hot and the cold. The 5 functions of the skin. I'm likening this to the facials that you're going to be doing. So absorption during the facials, the serums and the essential oils are actually absorbed through the skin, and including the nutrients, and the secretions. When you're steaming the skin, when you're hot, the skin is actually excreting impurities and toxins and detoxifying itself. Sebaceous glands, when they're overactive, produce more sebum, and this is why we get an oily skin. Regulation, the skin regulates itself. Whenever we're really active, the skin becomes really sort of hot, we start to sweat, and it just the skin actually vasodilates, which means it actually opens up, and the blood flow actually increases. Whereas when you're actually cold, the vasoconstriction that you go through just pulls in the skin, and your hairs, like when you're cold, the skin actually goes, the hairs end up on edge. That's actually vasoconstriction happening. When we're doing the cold compresses, when we're doing the cold masks, you're going through vasoconstriction, so it's all locking in the serums, the goodness that you're actually from the masks into the skin. There are so many nerve endings in the skin which actually help you, because they're actually your touch receptors. They guide you during electrotherapy facials to ensure that the client is receiving a treatment that's comfortable for them, because those touch receptors will pick up whether the probes are too high, whether it's painful, whether the temperature is right, or even if it's not working, the touch receptors will actually pick up there's nothing happening. And this is a really good guide for therapists, and this should be something that almost like during the facial, it's a conversation that you have with the client to actually gauge how the treatment is comfortable for the client. To preserve the acid mantle is actually really important, especially when you're doing facials. The acid mantle is actually sebum and sweat mixed together. That's what determines the pH of your skin and gives the skin its protective layer. So when we're doing chemical peels, it's really important to understand the pH of the skin, because if the skin has got a poor acid mantle, the peel is more likely to react. And even when we're doing the electrotherapy facials, if the acid mantle is compromised, then you're going to find that the client's skin is more reactive to the electrotherapy probes that you're actually putting on their skin. Clients should be advised to sort of not use harsh cleansers, toners and scrubs that can be very drying and alcohol based, because it can actually lower the pH of the skin and cause sort of all sorts of skin conditions. Balancing the acid mantle with any facials that you do is really important. Generally, a younger skin is usually an oily skin, and also oily skin is very common in ethnic skin. The characteristics that you're going to find in an oily skin is a shiny appearance, there's an oily T-zone, enlarged pores, they're prone to breakouts and blackheads, and the skin texture is usually quite thick. An oily skin is a skin that's genetic, it's inherited, or there's a hormonal imbalance which can be worsened by stress and the sort of foods that you're eating. Asian skin usually has a yellow undertone and is prone to pigmentation. Characteristics that you're going to find in a dry, dehydrated skin tends to be a Caucasian skin that's mature. What you're going to find with the skin is as that skin matures, it gets dull, it's no longer got the healthy look, shine, it feels a bit tight. Then you start to get sort of wrinkles and dry patches. They usually don't have any open pores. Treatments like galvanic ontophoresis, where actually you are infusing the serums and the gels into the lower layers of the epidermis, are really good for this type of skin. Hydroderm facial, mesotherapy, and skincare ingredients, hyaluronic acid, beta-glucan, and if I was going to use peels, I would use lactic acid, glycolic acid peels, which actually provide brightening and hydration to the skin. Very few people have normal skins. A lot of people have combination skins where they've got sort of normal cheeks and an oily T-zone, or dry cheeks and oily T-zone, or a normal T-zone. This type of skin, they can literally pretty much use anything, and the only time that this skin changes is if they're using products that are not right for their skin, like really abrasive alcohol-based products can dry the skin, and also heavy moisturizers can make it a little bit sort of greasy, oily. Understanding skin disorders is actually really important when you go into the skin journey, because your clients are going to come in with these disorders, and it's really important to know what they are and also be able to identify what treatments will be suitable for them and what treatments they shouldn't be having. Milia is quite common, especially in people that have like an oily skin or people that use incorrect skincare products. So clients that have milia around the eye area, you can usually identify it to the eye cream that they're using or the moisturizer that they're using around the eye area. It tends to be that the sebum gets trapped under the dead skin, and then there's no outlet for that to come out, so the sebum oxidizes and goes into like that white pus. Because it's not in an opening, it's not in a pore, it's actually impossible to extract. So one of the treatments that's good for that is actually plasma or advanced electrolysis treatment. Acne pustules, really best to avoid during treatment. They're red bumps, they're white or yellowish centers, and very tender to touch as well. Highly infectious, so any treatment that you do, they really need to be left alone and not broken. The treatment that really helps with that is high frequency. Acne vulgaris is generally blackheads, whiteheads and pustules, often cysts, commonly found in teenagers. The only treatment that I've seen working with acne vulgaris is actually taking raw Accutane, and that because it's actually internally deals with the problem. Most of the treatments are contraindicated for clients that have acne vulgaris. Acne rosacea is generally common in clients that are hormonally sort of going through changes, menopausal times, or the skin has been aggravated by extreme sun, cold, wind. Clients that are working outdoors a lot tend to get acne rosacea. People that eat a lot of spicy foods tend to get it. But it isn't a hormonal issue, it is a lifestyle issue. You tend to find that clients that have acne rosacea, there's very little treatment that can actually help that, because it's internally sort of activated. So when they go out into the cold or the heat, it flares up, and when it's not hot or cold, it tends to calm down and subside. I found that many salon treatments don't really help acne rosacea. They've got to really tackle that with their lifestyle management, and also through hormonal sort of balancing. Melasma is actually quite common in women that are pregnant. It tends to really be hormonal changes, which is like estrogen, progesterone levels are actually compromised. You tend to find that the melasma is generally caused when the client goes out into the sun when they're pregnant. It's mainly the women that are pregnant that this actually flares up in, and it sometimes flares up in clients that are sort of Asian clients as well. But very little treatment for melasma. Melasma, once you have it, is difficult to get rid of. Hyperpigmentation is mainly caused by the sun, and just being out in the sun without a sunblock, or maybe overexposure to the sun. And it can be also triggered by acne, an injury to the skin as well. Hypopigmentation generally is something that just is caused by overexposure to sun. It can also be caused by treatments like laser burns can cause hypopigmentation. Deep chemical peels can cause skin burns, can cause hyperpigmentation. And once the skin has hyperpigmentation, which is actually loss of melanin, there's no treatment for it. Nothing can actually recover that hyperpigmentation. They're always going to be left with a white patch. What sometimes helps it is occasionally when they go out in the sun, it tends to be like they can get a bit of a tan on it, but if it's not too bad, otherwise the clients are left with that. Red veins are usually caused by either hormonal sort of imbalance, or they're caused by temperature. So if someone is actually going out in the heat a lot or the cold, the pressure of the heat or the cold is actually caused the red vein to burst and come to the surface. And when it bursts and come to the surface, there is no going back. Unless the red vein is treated, they're always going to be remaining where they are. They can get worse progressively over time. The best treatments for red veins is actually laser and advanced electrolysis. Papulosa nigra is actually really common in skin types 5 and 6. It's hereditary. It tends to appear anywhere on the body, but most commonly it actually affects the face. There is no prevention on it. Sometimes the exposure to sun can aggravate it, but other than that, it's actually just really inherited. What really helps is the plasma skin lesion is one of the best treatments for it. Laser can help, but I tend to find laser tends to leave like a hypopigmentation mark once the lesion's been removed. Advanced electrolysis is also really good, but it can sometimes leave the skin with like a hypopigmentation white mark. Eczema is common in it's again inherited, but it can be aggravated by products. It can be aggravated by stress and treatments as well. But genetically, it's actually you tend to find it in sort of families. They tend to get worse with lifestyle issues, products that you're using. The eczema can be really just itching and red, or it can be really crusty, scaly and weepy, depending on obviously the intensity of it. Psoriasis again is inherited, and it's actually made worse by lifestyle. It's made worse by stress. The silvery scales can be a bit itchy, can be painful, and also under the silvery scales it can be quite raw skin, and that's something that you really need to be careful of. Herpes simplex cold sores is actually it's contagious. Once you have it, it actually is something in your body, and there are triggers. Like for example, if you've had it before and you do microneedling, you're going to find that with microneedling it does flare up. Any needles should be avoided if a client has history of herpes simplex. It can spread by contact as well. So if a therapist is actually using her hands without gloves and a client has the herpes simplex, there's a high chance of the therapist getting it if she touches her face. Electrotherapy treatments, we've got high frequency, vacuum suction, galvanic, EMS and microcurrent, and I'm just going to briefly go into the each of the electrodes that we're going to be using in this course. With the high frequency, we've got two different gases, the argon and the neon gas, which actually work on oily skin, normal skin and also dry skin. We've got vacuum suction with the diamond tip, which actually really help the skin with lymphatic drainage and remove dead skin cells. Galvanic introduces the products into the skin with the ontophoresis method. So we can introduce serums, masks and gels with the ontophoresis method, where it just can be transported lower into the epidermal layer. And the galvanic desincrustation is actually deep cleansing the pores, and they work on different energy levels. The EMS, which is the electrical muscle stimulator, that actually is really good for lifting saggy muscles and toning the skin. Microcurrent is a very sort of minute micro galvanic current which helps to keep the skin toned. It's very good for preventing the skin from getting wrinkles, and it's actually good on the onset rather than later. So if you've got really a lot of wrinkles and the skin is sagging, microcurrent isn't going to do much, but it's very good for preventing because it re-educates the muscles. With high frequency, you've got two different types of electrodes. You can buy two different types of machines, or you can buy one machine that has both in. The argon gas is very good for oily acne skin conditions because it actually produces ozone that's antibacterial. Whereas the neon gas is good for normal, oily, mature skin types. It produces a neon gas, which is like an orange light that stimulates the blood flow. Argon gas has a slightly sort of drying effect on the skin for an oily skin, so it's very good for a skin that has got excess sebum, and that would be the wrong one to use for a mature dry skin. The orange light is better for the mature skin because the warming effect on that electrode, what it does, it increases the blood flow, increases the circulation, and it's very good for drier skin. Some therapists actually have just one, and they will use that for all skin types, but it's not correct way to do that. You really need to make sure that you're using the right gas for the right skin type. Microcurrent is like the minute low-level galvanic current that re-educates the muscles, improves the circulation. It's not one where an aging skin is going to look very youthful in a couple of treatments. It's one that will actually slowly stop that muscle from like aging. So if the client is in the early 30s, early 40s, and they have microcurrent, it's really good. It makes the skin very sort of fresh and youthful looking, whereas a client in their 60s and 70s, microcurrent wouldn't actually be beneficial for them. They would need to go on to Botox and fillers and go a little bit more sort of invasive with their treatments. Even for a client in their 30s and 40s, you're looking at a course of treatments in order to keep the skin looking youthful. It's very good for restoring the muscle tone and strengthening the muscles that are on their decline and aging. There are two methods of galvanic that are very different. Desincrustation actually just deep cleanses the pores, emulsifies the sebum and draws it all up. It's actually really good for oily acne skin. The galvanic desincrustation actually works on the negative pole, which is a black wire. You recognize it as a black wire. And we used an alkalite solution to soften and emulsify the sebum and debris before we actually do the disincrustation. Ontophoresis helps to transport the ingredients from the gel, from the masks, from the serums into the deeper layers of the skin. It's very good for the ontophoresis is actually dependent on the effects of it is dependent on the skin that you're working on and the gels that you're actually working on. The gels could be for oily skin, it could be for dry skin, mature skin, for aging skin. So whatever the product that you're using is actually the effect you're going to get at the end of the treatment. The red wire is the positive pole, and that's the one that we actually use for ontophoresis. The serums are specially charged for the ontophoresis and disincrustation. Lymphatic drainage is usually done with vacuum suction and a glass ventouse, but it can also be done with dermabrasion and hydropule solution, and the directions that you're using are dependent on the what you're trying to work on. For example, if you're working on puffy under eyes, you're going to be doing in a certain sort of moving out in towards the nearest lymph node. So you should know the lymph nodes connected to the area that you're going to be draining out from. The lymphatic drainage massage is really effective for moving out cellular fluid, waste. So if you've got a congested skin, you can move out toxins. If you've got puffy skin, puffy under eyes, you can actually move out excess fluid from the area and just work it. And it also stimulates the lymph to work better. So long term, it's actually good for the condition itself. The EMS is electrostimulator, which is actually really good for contouring the face. We use it on the lower half of the face when the jaw is starting to sag. Very good for those muscle fibers, stimulates the muscles to work better, and it has a lifting effect. So the jaw area can be lifted. It needs about 8 to 10 treatments and regular treatments, sometimes even 2 a week, for it to really lift and tighten. It's like going to the gym. This one, you can exercise the muscles, and while the treatment is going, it's really good. You have like a toning, youthful lift, but it isn't like long term. If you stopped using the machine and if you stop doing it, the muscles tend to go back to their original state. But while you're doing the treatment, it's actually really good. It strengthens the muscle fibers and has a really good toning effect. Very good for the crow's feet wrinkles as well, and it helps to smooth those crow's feet wrinkles in a shorter time than the jaw. Within about 3 to 4 treatments, you tend to find that they're really nicely smooth. Exercising the muscles is actually really keeping the skin looking sort of lifted and youthful. These are the contraindications to electrotherapy treatments, and they all should be observed. Clients having any of these cannot have any of the electrotherapy treatments. The pre-treatment precautions for electrotherapy treatments and the aftercare, some of these are actually included in your theory exams, so learn them. If you've got a client coming in, they should be prepared before the treatment for the electrotherapy probes. Note that no jewelry should be worn by the client or the therapist during the treatment. Test the electrode before use and make sure it's actually disinfected after use. Before you place the electrode on the face, make sure that the client is informed about what they're going to feel, what the temperature is like, whether there's any pain to be expected. Prepare them before you actually put the probe on their face so that they know what to expect if it's their first time. Start with the lower energy and work your way up depending on the client's tolerance levels. Decrease it in the areas that is sensitive, increase in the areas that actually needs more work. So you're always sort of as you're doing the probes, you're actually adjusting it according to what you've got in front of you. If the client has dermal fillers, make sure that the vacuum suction isn't done, like lymphatic drainage vacuum suction isn't done on the area where the fillers. Ask the question before you even start, have you got dermal fillers? Avoid those areas because it can displace the fillers. If a client has had Botox, avoid the areas where there has been Botox with the EMS and microcurrent, because both of these will actually reduce the effects of Botox very quickly. Some of these are going to come up in the exam, so just learn these. Giving aftercare advice to clients helps to prevent possible post-treatment reactions that the client may have, and helping them to manage those reactions is actually part of your aftercare advice that you should be giving. If a client has any allergic reaction during the treatment, you should stop the treatment, remove the product and apply a soothing cream. When it comes to giving home care advice, you should give the clients advice that would improve the effectiveness of the salon treatment you've just given them. You should recommend that they use the skincare products suitable for their skin type. If a client suffers from epilepsy, don't do any high frequency machine on them at all because it can trigger an attack. You should recommend clients not to have UV exposure as the pigmentation, it can cause the pigmentation and also cause the skin proteins and enzyme in the skin to break down, damage the cellular structure of the skin as well. So what's happening is the lower layer of the skin is actually being damaged as well as getting pigmentation. Client has a back problem and is uncomfortable during the treatment, put a pillow under their knees, and if they're cold, just put a blanket on them. Make sure that the clients are really comfortable during the treatment because they're lying there for quite some time. Work surfaces and electrical equipment that you're using, including the probes, should be disinfected following manufacturer's instructions only. This has given you sort of, everything that you need to know about electrotherapy treatments. And beyond this, that we're going to do another PowerPoint presentation that actually teaches you the anatomy and physiology that's required for the facial electrotherapy.